Hello everyone. One of the important issues that the elderly need to pay attention to is the use of medication. In the elderly, the body often has changes in metabolism and organ function. Therefore, medication can affect the body in a different way than in younger people. One of the biggest concerns is the side effects of medication. This not only affects health, but can also lead to serious complications if not controlled. Today, in this video, we will learn about the side effects of medication for the elderly and instructions for safe medication use to help the elderly manage their health effectively and safely. If you or a loved one is taking medication regularly, this video will help you better understand how to use medication safely and prevent unwanted side effects. Let's follow along. In the elderly, the use of drugs needs to be carefully monitored and controlled because their bodies react to drugs differently than younger people. Physiological factors, changes in body function, and underlying diseases are the main reasons why the elderly are prone to side effects when using drugs. Here are the main causes leading to this condition. 1. Changes in the function of organs in the body. As the body ages, the organs in the body become less effective in processing and metabolizing drugs. The liver and kidneys are the two main organs responsible for metabolizing and excreting drugs. However, as age increases, liver and kidney function declines, slowing down this process. This causes drugs to not be eliminated in time and can accumulate in the body, causing side effects or drug poisoning. The liver is the organ that helps metabolize drugs, while the kidneys are responsible for excreting drugs from the body through urine. When the function of these organs decreases, the drug will not be processed in time, leading to high drug concentrations in the blood and causing serious side effects such as liver failure, kidney failure, and other problems. 2. The body's sensitivity to drugs gradually decreases. As people get older, their bodies become less sensitive to certain drugs, especially pain relievers, sedatives, and blood pressure medications. For example, sedatives can make older people feel more tired, sleepy, or lose their balance than younger people. This can lead to a risk of falls or accidents for older people. Some drugs, such as antidepressants or sedatives, can affect the nervous system of older people. Therefore, the use of drugs for the elderly needs to be carefully adjusted in dosage to avoid causing unwanted side effects such as loss of balance, depression, or confusion. 3. Drug combinations and drug interactions. Older adults often have to take multiple medications at the same time to treat different conditions. However, using multiple medications at the same time can lead to unwanted drug interactions. These interactions can reduce the effectiveness of the drug or increase the side effects of the drug. For example, when older adults use blood pressure medication combined with a diuretic, it can cause a sudden drop in blood pressure, leading to dizziness and fainting. Or when combining sedatives with pain relievers, it increases the risk of excessive sleepiness, making it difficult for the patient to wake up or lose control. 4. Genetic factors and underlying health conditions. Genetic factors and underlying health conditions of older adults can affect how the body processes drugs. Some people may have special genetics that make their bodies react more strongly or less strongly to drugs than others. In addition, underlying medical conditions such as diabetes, heart disease, high blood pressure, or respiratory disease can change the way the body processes and responds to medications. For example, older adults with diabetes may have difficulty regulating their blood sugar if they do not take the right dose of diabetes medications, or if they do not combine them properly with other medications. Cardiovascular diseases can also change the effectiveness of blood pressure medications, causing the patient's blood pressure to become unstable. 5. Long-term side effects of medications. When using medications for a long time, older adults may experience long-term side effects that reduce their quality of life. Some medications, such as nonsteroidal anti-inflammatory drugs, NSAIDs, or antidepressants, when used long-term can cause stomach ulcers, digestive disorders, joint pain, or memory loss. Long-term use of medications should be closely monitored by a doctor to minimize the risk of these long-term side effects. Elderly people need regular health checkups to assess the effects of drugs on organs in the body and adjust the dosage when necessary. Gue Wai Kien Fan Hoi. Bang Jukin Ben. Kak Ben Dike de Tukien. Delu. 2. Guidelines for safe medication use for the elderly. Safe medication use for the elderly includes not only choosing the right medication, but also following specific rules and guidelines to minimize side effects and drug interactions. Here are detailed guidelines to help the elderly use medication safely and effectively. 1. Consult a doctor and pharmacist. Before starting any medication, the elderly should consult a doctor and pharmacist to make sure that the medication is suitable for their health condition. Check the medications being used. The doctor needs to know all the medications the patient is using, including prescription drugs, non-prescription drugs, dietary supplements, and herbal medicines. This will help the doctor avoid prescribing drugs with bad interactions or unwanted side effects. Evaluate the dosage. The dosage of medication may need to be adjusted for the elderly. Adjusting the dosage helps reduce the risk of side effects, especially for drugs that are strong or affect liver and kidney function. Prescription. The doctor will prescribe the appropriate medication, avoiding the patient from buying medication without a doctor's instructions, which can be dangerous to health. 2. Use the correct dosage and as prescribed. One of the important principles in using medication is to use the correct dosage and as prescribed by the doctor. This not only helps increase the effectiveness of treatment, but also helps avoid unwanted side effects. Do not change the dosage on your own. The elderly should not arbitrarily increase or decrease the dose of medication without consulting a doctor. Changing the dose on your own can cause side effects or reduce the effectiveness of treatment. Take medications at the right time. Some medications need to be taken at certain times of the day. For example, blood pressure medications should be taken in the morning or sedatives before bed. This helps the medication work best and minimizes side effects. 3. Manage medications and record usage. An effective way to ensure that older adults use medications safely is to manage the medications they are taking. Here are some methods to help manage medications. Use smart pill boxes. Pill boxes that are divided by day and time will help patients remember to take their medications on time and in the right dose. Record medication usage. Older adults can record the time, dosage, and type of medication used each day to monitor and report to the doctor during follow-up visits. 4. Check for side effects and monitor health. Elderly people need to monitor for unusual symptoms after taking the medicine, to promptly recognize and notify the doctor if there are side effects. This helps the doctor adjust the medicine or dosage to suit the patient's body. Check for reactions after taking the medicine. If the elderly feel tired, dizzy, have a stomachache, have a rash, or any other signs, they should stop taking the medicine and notify the doctor immediately. Regular health assessment. Elderly people need regular health checkups to assess whether the medicine is having a therapeutic effect and is not causing unwanted side effects. 5. Dietary supplements and supplements. Elderly people often use dietary supplements or vitamin supplements to improve their health. However, combining dietary supplements with medicine can cause drug interactions or side effects. They should discuss with their doctor before using any dietary supplements. Use only when prescribed. Use dietary supplements or vitamin supplements only when prescribed by a doctor or pharmacist. Pay attention to drug interactions. Vitamin K, commonly found in dietary supplements, can affect the effectiveness of anticoagulants. Discuss with your doctor before adding vitamins or dietary supplements to your diet. Using medication safely and properly is very important, especially for the elderly, when the body is susceptible to side effects or unwanted drug interactions. To ensure safe use of medication, the elderly need to consult a doctor, follow the instructions correctly, and monitor the body's response to medication. Good medication management will help the elderly control their health effectively and safely. Always remember that your health is precious, and using medication properly is an important part of maintaining a healthy life. Thank you for watching the video. Please share this video to help people better understand how to use medicine safely. Don't forget to like, share, and subscribe to the channel to receive more useful videos about healthcare. See you in the next video.